Good afternoon, everybody. We see people continuing to join us. Again, I'm John Brewer with the Chamber of Commerce. We'll get started in just a couple of minutes, but if you'd like to post a question to any of our speakers at any time during the program, including now, please feel free to go to the bottom of your screen in the Q&A box and ask your question there. If you want to direct it to somebody specific, do so. If you want to keep it more generic, we'll let the person who is best equipped to answer it go ahead and do so. So the format for today's program will be presentations for about the first 45 minutes or so, and then we'll set aside at least a half hour for your question and answer. So please take some time and type your question into the Q&A box, and we'll get to as many of those questions as we are able. And again, we'll get started in just a minute or two here. Thank you. Since we do have a full agenda today, we'll go ahead and get going. I know there's still some people coming in through the participants portal there. So again, good afternoon and welcome to another program in the Billings Chamber of Commerce Tele-Town Hall series. I'm John Brewer, President and CEO of the Billings Chamber of Commerce, and I'm joined today by Melanie Schwartz, the Director of Business Development for Big Sky Economic Development, who's going to help me co-facilitate the question and answers that hopefully we'll be posting in that Q&A box. We're bringing you this series in partnership with Stockman Bank, Entree Technologies, and Big Sky Economic Development. The Town Hall series is designed to connect you to leaders and decision makers on important issues relating to COVID-19 and your business. Today's Town Hall features a discussion on the COVID-19 vaccine. We'll be discussing the vaccine's efficacy, distribution here in Yellowstone County, and liability issues that you should be aware of. We're joined today by John Felton, a Yellowstone County Health Officer, Dr. Bush, the Chief Medical Officer at St. Vincent Healthcare, Dr. Elner hopefully will be joining us shortly, CEO at Billings Clinic, and Bruce Fain with Crowley Fleck. So at any time, again, if you have a question, please feel free to post that in the Q&A box at the bottom, and we'll get to as many of those questions as we are able. So since this is such an important topic, we will plan on extending these normal hour-long events to at least an hour 15, and we'll see how the questions are coming in and how long our guests are able to stay with us. So with that introduction, John Felton, I'd like to turn it over to you to talk about distribution and your recent survey results.
All right, thank you, John. Thank you, everyone, for being here. We're going to jump right into this. I'm going to give you sort of some overview of where we are. Hopefully you see that. Where we are in terms of vaccination in our county, and then share with you the results of a survey we recently did. So let's just jump right in here. Oops. So, oops, there we go. So under the federal and state and local plans, the categories of people are tiered. And what I'm showing with you now is what Governor Gianforte changed a little bit. He changed the 1B and 1C that Governor Bullock had. So these are the current standards. So Tier 1A are patient-facing healthcare workers, first responders, and long-term care residents. Those long-term care residents are being vaccinated mostly through contracts with several national pharmacy chains and a statewide chain. The other ones have been vaccinated through our local healthcare groups. So 1A started early on. As you know, these vaccines are 2-dose vaccines. And Dr. Bush and Dr. Elmer get into a lot more detail about the vaccines themselves. So to really be fully vaccinated, you need to be a couple weeks out from the second vaccine. And the second one happens 3 or 4 weeks after the first. So middle of January, on the 18th, we opened up Category 1B. Category 1B in Montana is anyone 70 or older, anyone 16 to 69 who has one or more, there's specified medical conditions. So it's not just that you have underlying disease. There are specified conditions that qualify as 1B, as well as Native Americans and other people of color, recognizing that those populations are at much higher risk for poor outcomes. And what Governor Gianforte did in redefining Category 1B is he tried to focus on those that are at highest risk. So something like 75% of all Montanans who have died of COVID-19 were 70 years of age or older. 1C goes back to what Governor Bullock had as 1B, which really identifies a number of essential workers. And I have to say, I kind of wish no one would have ever come up with the term essential worker, because I think all workers are essential. And I think it causes a lot of upset for good reasons. But that includes things like educators, childcare workers, infrastructure workers like the refineries and electrical workers and things like that. Anyone who's age 60 or older, regardless of any underlying conditions. People 16 to 59 with, again, a set of specific healthcare conditions, as well as people living in congregate or correctional facilities. I would note here, the reason this says 16 to 59 is the vaccines have not yet been tested on children. So the Moderna vaccine can be used for anyone 18 and older, the Pfizer vaccine on anyone 16 and older. When you get to Category 2, Tier 2, it's everyone. Anyone 16 and older will be eligible for a vaccine. So where we are right now is we're in 1B. And as I said, this is the same description for 1B. It also includes anyone remaining from 1A. So as these move along, anyone in a higher category can still get vaccinated if they haven't been yet. So if, for instance, we had a first responder or a healthcare worker who hasn't yet been vaccinated, or a 1A person, they can come in during the 1B period as well. The numbers here get a little daunting. And these are some estimates out of the Montana COVID-19 vaccination plan. 1A is about 60,000 people in Montana. That's the estimate. We apply kind of the 15–16% population that is Yellowstone County. So it's an estimate of, so about 10,000 people in Yellowstone County will be 1A. 1B is close to 300,000, so we're somewhere between 45 and 50,000 in Yellowstone County. 1C and 2 have not been counted yet, but it's obviously a big number. What we've been getting in Yellowstone County is most weeks, the Pfizer vaccine goes to Billings Clinic and St. Vincent Healthcare. Now those come in trays of, or packs of 975 doses. That's the vaccine you've heard about that needs to be kept at the super cold temperatures, the -80 temperatures. So you have to have the storage capacity to keep that vaccine at that very low temperature, which the hospitals do. The Moderna vaccine, it can be kept basically in a household freezer. So Billings Clinic, Riverstone Health, and St. Vincent are all eligible to get Moderna. Now, there are a lot of sites, so a lot of our medical clinics and other places have applied to be points of distribution for the Moderna vaccine. Right now, though, it's only coming to Billings Clinic, St. Vincent Healthcare, and Riverstone Health. Most weeks, we get about 2,000 doses. So each hospital has been getting 975, or one case of Pfizer, and Riverstone Health has been getting about 100 Moderna. Now, bear in mind, these are first doses. So when we say we have, for instance, 2,000 doses in town, that means that we can vaccinate 2,000 new people. When the second dose comes in a separate shipment, if you will. As I said, long-term care facilities are separately supplied. So here's the vaccination math. Somewhere there's north of 50,000 1A and 1B people in Yellowstone County. And as I said, we're receiving about 2,000 doses per week. I would note this week, only one of our hospitals received Pfizer vaccine. That was not any sort of slight at the hospital, but there are more sites that receive Pfizer, more hospitals that get Pfizer vaccine than there are trays of it. So every week, some hospital doesn't get Pfizer vaccine. This just happened to be our week. So if we have 50,000 people and we're predicting about a 75% uptake, meaning that 75% of that group will likely choose to get vaccinated. And if you have 2,000 doses per week, here's what the math shows us. That's what we're seeing a lot of. There's a lot of really, really frustrated people out there, and we understand that. The demand for this vaccine is very high. The supply is very low. So for all the economists among us, it makes perfect sense why this is just so frustrating for people. The vaccine comes from the federal government to the Montana Department of Public Health and Human Services and then gets distributed through the state. Montana, for a number of weeks, has only gotten about 13,000 doses of vaccine. That's double what they were getting the few weeks before that. And so 13,000 doses spread across the entire state just doesn't go very far. So you probably saw in the news that on Monday, Billings Clinic received somewhere north of 25,000 calls. Our phone lines are burning up. St. Vincent phone lines are burning up. People really want the vaccine, but because the supply is so low right now, it just runs out quickly. We run out of slots. The thing I'll mention about this vaccine is it is scheduled. So you need to make a time to go in and get the vaccine. That's for a couple of reasons. One is that obviously the disease is still circulating in our community. We're still seeing new cases every day. So compressing a whole bunch of people into a big space and moving them through a big line is not a safe way to avoid the spread of disease. The other thing about this vaccine is there are a very few, very small proportion of cases where a very severe allergic reaction has happened. And to make sure that people are kept as safe as possible, after you get your vaccine, you need to be monitored or watched for 15 to 30 minutes. So we need to be able to keep people appropriately physically distanced now as they're getting the vaccine and their waiting period. So that's why it's all scheduled. 2,000 slots go very, very quickly. As we move forward, we are very hopeful that there'll be more doses of vaccine coming. We're fortunate in our community that the healthcare institutions that you're going to hear from today, St. Vincent Healthcare, Billings Clinic, and Riverstone Health, along with Yellowstone County Disaster and Emergency Services, formed the Unified Health Command many, many years ago, actually back in 2001. We've been working together since then. And so we recognize that right now, with the small volume of vaccine that we have, we can each distribute those on our own. But we also recognize that if we had lots and lots of vaccine, we could do better in a more community-wide shared clinic. So we're fortunate that we've worked together a lot. We're used to planning together, and so those plans are being made. Right now, we're still administering the vaccine at Riverstone Health, Billings Clinic, and St. Vincent Healthcare. I'm going to change gears here real quick and go to a vaccine readiness or hesitancy survey that we completed. This was put out publicly. It was open for a month. And so I'm just going to go through the results with you. This is what the response group looked like. The key thing to take away from this, our epidemiologist did this, and so he's really good with numbers, but let me just say what it really means. The key to this is that we had an atypical population. The results cannot be generalized to the entire population because there was more, it wasn't representative of the entire population. So it's overrepresented for older adults and women. So you can't completely generalize these results, but we did get 4,000 responses, so we felt good about that. So this is, this asks, how likely are you to get a vaccine as soon as available? And you see it's really high. About 75% of people will definitely or probably get the vaccine as soon as it's available. When we ask if you're less interested in getting the vaccine, what are your concerns? And so the little red box down there, the concerns that the vaccine has not been tested enough among people who are like me. And that could be by race or age or ethnicity. But it's just a sense of discomfort about, has my population group been tested? General concerns about safety and general concerns about side effects. So that you can see that between 60 and 70% of people who are less likely to get the vaccine those are their primary concerns. When asked for the people who are more hesitant, what would make you more likely to get the vaccine? It's really about evidence. So those top three boxes there, evidence that it's effective, safe, and evidence of safety and effectiveness in people like me, that matches beautifully with what we saw before. That's the biggest concerns, and that's what people need to see, those who are currently vaccine hesitant. You'll notice that about 40% of this population, and mind you, these are the folks who said they are resistant to the vaccine right now. 40% of them have made the determination at this point that nothing will make them decide to get the vaccine. When we ask where did you feel most comfortable getting the vaccine, it's kind of what you'd expect: healthcare providers, urgent care, walk-in clinics, or pharmacies. That's pretty much the big ones. Again, there's 13% that say they're not going to get it. 22% would like to get their employers, and then there are a smattering of other responses. But you look at that top line, almost 3/4 would prefer their healthcare provider. This is an interesting question. It's about what do you perceive as the threat? And so the green box is a major threat, the blue box is a minor threat, and the yellow is not a threat at all. And what's interesting about this is look at the health of the United States, the health of Yellowstone County, and personal health. People are far more concerned about the impact of the virus on the country and the community than on themselves. And you see the same thing with the economy. People are far more concerned about the threat of COVID-19 to the US economy than to their personal financial situation. So there is this sense of shared risk that we saw pretty strongly in these data. This was kind of your question about what do you think, are we beyond the midpoint or short of the midpoint? And about 60% of people think that the worst is yet to come. And we hear a lot of this in the news. There was a report that just came out through the Federal Coronavirus Task Force that there could be as many as 90,000 deaths in the United States over the next 4 weeks. So, I think a lot of people believe that we still have a long ways to go. This is another question about how concerned are you about the virus and that you might spread it or you might get it. And this is very consistent with what we saw earlier on the degree of threat. People are far more concerned about, significantly more concerned about spreading the virus than getting it. So again, we're concerned about our friends and neighbors and families in the community. This question asked about how prepared our healthcare systems are to manage the number of people seeking treatment. This is, again, consistent with the earlier question. Do you think that the worst is behind us or ahead of us? We've seen, if we go back to mid-November, we had well over 150 patients, COVID-19 patients in our 2 hospitals. We've seen that come way down. Today is the lowest number that I have in my database. I think there's 34 COVID-19 patients in our 2 hospitals today. So we're really down about 20% of where we were at the peak. But again, about 65% of us think that because the worst is ahead of us, that we'll still struggle as we go forward to manage the care of the number of people. This one, I'm going to ask it to not pay attention to the blue circles. That was on the PDF that I used here. But this is how concerned are you? Oops, sorry. So going to the grocery store, not too concerned. Eating out or attending an indoor sporting event, 60 to 80% of us are concerned about that. Inside home visits, 60% of us are okay with that. But if you look at the things that are, and going to a salon or a barbershop, where it's kind of one-on-one, we're not as concerned about that. But when you look at where people compress. So attending a crowded party, going to a worship service, or going to a bar, that's what concerns us. So I think what that tells us is the message is clearly out as to the risks are associated with compressing people together. And I want to be really clear, these data I don't believe are any sort of indictment of any of these kinds of places. The reality is that where you put more people in less space, the risk of transmission of disease is much higher. This one asks people about their own mask wearing behavior when they're out in public, like stores or that sort of thing. And 90% of us say that all or most of the time we wear our masks, and then the other 10% are spread out over the other questions. So I think we've been at this for a long time, and I think everyone understands the way that we slow the spread of COVID-19 is through those basic measures that we all know, like wearing your mask and keeping your distance and washing your hands and staying home when you're sick. And I wouldn't go so far as to say people like those limitations, but I think we understand them. And then this one really gets to the question of how personal is COVID-19 to us. And early on, I said this in public a number of times, COVID-19 was kind of an abstraction for most people. Most people didn't know anyone who had been sick. They didn't know anyone who had died. But we all experienced the effects of social isolation and job issues and economic uncertainty and economic loss. Now, when you look at this, almost 7 out of 10 of us personally know someone who has either died or been hospitalized with COVID-19. And I really believe that is what's fueling a lot of that last data point about the number of us who wear masks consistently is now COVID-19, sadly, is much more personal to us because a lot of us know somebody who's been seriously impacted by it. We're going to switch in and just a couple quick slides on if we put people into groups of those who are accepting of the vaccine. So these are the ones who are definitely or very probably going to get vaccinated as soon as it's available. The rejection, the folks who said absolutely not, and then there's that little group in the middle that are hesitant. And so when we look at that, what we see is age makes a real difference. So older people make up a much higher proportion of the accepting group and a much lower portion of the rejecting group. And younger folks are kind of the opposite. So I think part of that has to do with the perceived risk. You'll see that in a minute. Also, I think people who are older have been around, some of those folks remember polio and they remember measles and those kinds of things. So there's a little different sense of the belief in vaccines. The gender, women are a larger proportion of the population, but gender doesn't really impact whether someone is hesitant, rejected, or accepting the vaccine. It doesn't seem to be driven by gender. Risk factor does impact it. So the highest priority, if people are in those high risk groups, are much more likely to be in the accepting group. If you look down, I don't belong to any of these groups. That sort of purplish, pinkish block on the bottom, you see, it's quite a bit smaller in the accepting group than in the rejecting groups. Kind of the same result when you look at if there's family members who are in those groups. And then this is a little more depth on the threat. And when we look at the group that is accepting of the vaccine, you'll see that those pinkish bars, the major threat, and the green, the minor threat, are much longer than they are in the rejecting group. So you go down to the rejecting group, you see that blue bar quite a bit longer, saying that those of us who are not interested in getting the vaccine really don't see the virus as much of a threat to their personal health or financial situation, or the U.S. economy or the health of population. So that makes a lot of sense, I think, when you think about if you perceive a greater threat, then you're more likely to take a measure that could be helpful in obviating that threat. So with that, let me stop sharing. I will, we'll get to questions there, but I will stop there, John, and hand it off.
Thank you, John. And a reminder, if anybody has a question, please post those questions in the Q&A box at the bottom of your screen. John, we appreciate that presentation. We will circle back shortly to question and answer. We're going to transition now to the effectiveness of the vaccine. It seems that there's been a lot of misinformation circulating via social media, and I think resulting in maybe some unfounded fears. And we've asked both Dr. Elner, the CEO of Billings Clinic, and Dr. Bush, the Chief Medical Officer at St. Vincent Healthcare, to share some thoughts with you. So we'll start with Dr. Elner and then Dr. Bush.
Yeah, thanks, John. It's great to be here. And I will tell you, there's a lot of excitement that the vaccine is finally here. As John Felton had mentioned, on Tuesday, we received 27,000 calls between 7 a.m. and 10:30. I'm sure that's happening across the state. And we're now putting a third-party call center in place in order to be able to handle that call volume. But what this tells me is there's genuine interest, that people certainly are wanting to get the vaccine, and that's a good thing because the effectiveness of both vaccines is roughly 94% and 95% respectively for Pfizer and Moderna. There have been questions, is one better than the other? And I think right now the data doesn't really support one over the other. It's about supply. If you have access and are able to get an appointment to become vaccinated for your first and second dose, do it, regardless of which one it is. I will tell you, as far as the maybe side effects that people are talking about, we're seeing some limited side effects, mostly some fevers, maybe a little bit of shaking, chills at worst that lasts anywhere from 24 to 36 hours. And the response is actually an immune response to that spike protein that you want. You want the ability to create immunity within your body in order to prevent from getting COVID. The other thing that we're seeing is there's some recent data now out of Israel where they just found that approximately after the first shot, you have a 33% likelihood of not getting infected or not becoming infected. So even getting that first dose starts to develop some immunity and protection. But I would say you need to still get the full first and second dose to get the full effectiveness of the vaccine. A lot of questions that we get at Billings Clinic also are, is this going to be mandatory? And we are not mandating that our employees are getting the vaccine. In fact, fortunately, we have Bruce on here. I don't think you can make it mandatory because this is an emergency use authorization of the vaccine. However, we are asking all of our employees at Billings Clinic, and I would strongly recommend that to your employees to try to get the vaccine as soon as it becomes available to them. Other questions stem from, well, if I'm pregnant, should I get the vaccine? And right now, we still don't have evidence to show that you should not get the vaccine if you're pregnant. So there's just not enough data to support not to do it. And the safety profile right now shows that it's relatively safe to still get the vaccine with pregnancy. The other questions we're hearing are about allergies to the flu shot, allergic responses. If you have an allergy and you think that you, in the past, you've had a reaction from, say, the flu vaccination, consult your physician first before getting the vaccine so that, that we can at least monitor and track whether or not you are at risk of getting an infection, or if you do get getting an allergic reaction. But we'll have to watch you closely. And that's why we keep people approximately 15 minutes or longer after the vaccination at our site, and I think they're doing it also up the street at St. Vincent's, to just monitor your reaction right after you get the first and second dose. We have not seen anything that tells us it's unsafe. In fact, it's been a very good experience for our employees and the people in 1B that have received their first or second dose or both. And I will tell you, there's hope. There's hope right now that we're going to get through this pandemic. It's going to open up the businesses. It's going to keep people out there being social. But we got to get as many people as we can vaccinated. And as long as that supply keeps coming, we're going to turn around and give it as quickly as possible. So with that, I'll give my time up to you, Dr. Bush, and then I'll be happy to answer any questions that come forward.
Okay, thank you very much, Dr. Elner. So I really appreciate what Dr. Elner has had to share with us. I would say that I have certainly heard from people that one of the big concerns that comes forward is this vaccine was developed so rapidly. How do we know it's safe? And I would fill that answer or provide that answer from a couple of different standpoints. Number one, we have a tremendous amount of basic science research that exists with these messenger RNA vaccines. We've been working at this for 10 years. We have several other messenger RNA vaccines that have been developed, just not with this kind of volume. And then you see those pictures of the coronavirus, and you see all these little suction cup things sticking off the side of that electron micrograph picture. And you heard Dr. Elner talk about the spike protein. That suction cup thing is actually the spike protein. And so the vaccine has been designed such that there's a little bit of messenger RNA that ends up in your cell and develops the protein that is that spike protein, and your body recognizes that as foreign and develops antibodies to it. And then that's how that works. The little bit of RNA that enters your cell then just deteriorates over several weeks and goes away. And so it doesn't alter your body's DNA. That was one of those myths that was out there, and other things. And so again, there was at least 10 years of work that this is based on. And so that's the reason it was able to come along so rapidly. Also, a typical influenza vaccine that we would roll out might only be tested in 8,000 to 10,000 people before they roll it forward. These messenger RNA vaccines, the vaccines that have been developed for COVID, were tested in 35,000 to 40,000 people. And then they were released. And then we do know that we've been tracking data through the CDC and other places, and the risk of getting a anaphylactic reaction is somewhere between 1 per 100,000 and 1 per 400,000 individuals that would get infected with it. And if you get infected with COVID, your risk of having a serious illness is much less than that. So again, I would encourage you to know that the vaccine is safe. Personally, I did go through both injections of the Pfizer vaccine, and I did have a little reaction to the second one. I got my vaccine in the evening on a Thursday night, and by Friday morning, 7 o'clock, I had mild muscle aches. And then by noon, it was like somebody turned the light off. I just went home and went to bed and went to sleep. And I woke up Saturday morning and I was fine. But I've heard that fatigue as a very common effect as one of the minor symptoms that people can experience. I would tell you, in terms of getting these scheduled, the biggest issue is the flow of vaccine into the community that John addressed. We have been running a vaccine clinic, much like the Billings Clinic has been. It's a very efficient process, and it's been working pretty well for us. We do have, John had asked me to address how you would get a vaccine, and we do have a couple of different ways to do that. We are actually releasing a press release here shortly that'll provide this information, but there is a website that you can go to, sclhealth.org/vaccine form, and then you can put your information in, asks a few questions in there that then helps us sort you into what tier you belong to. And then we would take that information, and folks in our registration center will call you and get you scheduled for an appointment when your tier comes up and when we have space for those visits. We also have a phone number that you can call, 406-237-7050. And again, that'll be released. But that phone number is only answered Monday, Tuesdays, and Wednesdays between 10 and 11 in the morning. And so again, if you have access, and we're saving that for people that are technologically challenged, et cetera. But again, if you can access the internet and so on, then we can take anybody who belongs to any tier, and then we'll keep that database and reach out to people. One other question that I would address that came up in the question and answer session is people were asking about these variants of the virus that you've been hearing about from Great Britain, South America, Brazil. And we believe that the data is showing the vaccine is not quite as protective against those variants, but it is very protective with those variants from preventing you from having serious illness. So if you were to get one of the variants, you might have something like a mild cold or something like that, but you're not at all likely to end up critically ill in the hospital. So those variants will be tracking through the state lab and other ways as they potentially enter the state. So I'll turn it back to you, John. Thank you.
Thank you, Dr. Bush, Dr. Elner. We'll get back to some additional questions I see coming in the Q&A box too at the end of the program. But I would like to turn now to discussion of requiring your employees to be vaccinated. We've fielded a number of calls at the chamber. I'm guessing those folks at the EDC have as well, with businesses asking, can or should they require their employees to be vaccinated before they come back to work? The chamber doesn't advocate for that at this point. We are just encouraging people, as Dr. Elner and Dr. Bush have said, to get their shots. But we wanted to ask the professional. Bruce Fain is an attorney at Crowley Fleck, and we've asked Bruce to kind of walk us through some of the liability questions that have been brought up. Bruce.
Thank you, John. I appreciate the opportunity to talk today. I'll start out by my presentation first by noting that there is as has been pointed out by Dr. Elner, a real issue with the COVID vaccine and being able to mandate employees get the vaccination. And that's because it's an emergency use authorization. The medical community requires a lot more informed consent, I believe, during that process. But what you're going to see and what we'll talk about is, I guess, on the basis that as we proceed further, at least in my mind, as we proceed further, that may change, that situation may change, and it may become more like a regular influenza vaccine that's out there. And that is something that does come up quite frequently. And also, the EEOC has released, and OSHA have both released employment-related guidance that does not address medical particular issues concerning vaccines. And so that's really where I'm going to focus today, because I think ultimately you'll find as we go through this process, yes, I agree with everybody else, in particular in regards to the COVID vaccine. Your best approach is to encourage your employees, perhaps offer some incentive for them to get the vaccination as it comes available. So give me just a second here, and I'm going to get my screen share. And there, can everybody see that now? It's all right, good. I can't really see it. First off, we're going to talk about, like I said, vaccinations in regard to employment laws in particular. First off, what you need to keep in mind is in regard to all vaccination programs, we have basically discrimination-based laws you have to take into account, as well as safety and regular employment laws. And I sort of grouped them together as to where they are. The discrimination-based laws are the Americans Against Disabilities Act, Title II of the Genetic Information Non-Discrimination Act, or GINA as it's referred to, and Title VII of the Civil Rights Act. And I'm going to lump into that the Montana Human Rights Act because it's also an anti-discrimination statute, which is based and patterned quite a bit on Title VII. The next would be safety and employment laws that I'll just consider, and one of them would be OSHA, and the other one would be the Montana Wrongful Discharge from Employment Act. First, EEOC guidelines have been released concerning the COVID-19, the ADA, the Rehabilitation Act, and other EEO laws. You can write down the link here, or you can just search for EEOC. It's very easy to find. They've updated it frequently concerning guidance in dealing with COVID in general, and including vaccinations. In fact, the I believe it was the December 16th, 2020 update, which addressed vaccines. Just some of the things to take into account. The administration of a vaccine is not an exam for purposes of the ADA or GINA. And now that's important because you're not really entitled to engage in exams of your employees that can implicate or disclose disabilities or genetic information about their family or themselves. However, preliminary questions can trigger ADA or GINA, such as questions about a person's genetic makeup or any particular issues that they have. And so that's why, if it's offered voluntarily, if an employer offers the vaccine voluntarily and no answer is provided to those, you can refuse the vaccination, but you can't ask questions about why they might. And the next thing is, really and truly, the best practice is let them select their provider, because then it takes the employer out of the ADA kind of questions and the GINA questions. And the only thing then you would ever have to request would be some sort of a verification that they had the vaccine, if they had actually received it. And there would just be, yes, they received it. There we go. Some of the exemptions that you typically see in all of the vaccines in dealing with vaccinations and mandatory vaccinations. One of them is there may be medical reasons an employee should not have a vaccination. All employers should always apply this exemption, I believe. It's very difficult to very difficult to justify not providing medical exemptions if necessary. Generally, most employers that do this require some verification by a doctor, a MD, or a DO. You also have to consider any sort of accommodations that you would put in there. And generally, what you need to do is establish a direct threat to the employee or to others before excluding them from the workplace. And so, in other words, you should consider masks, PPE for employees. You should consider remote work. Work with them to try to work through a process as to how to deal with this situation. Some basic other guidelines for religious objections that are out there. If it's requested, you generally must provide it. You are very limited in how far you can query an employee concerning the validity of their religious belief. Really, you basically have to have something objective that leads to the fact that maybe it's not a true religious belief. And it's a real high hurdle. So you need to be real careful if you were to do that. Accommodation is not required if an employer can establish an undue hardship, which the EEOC guidelines state is more than a de minimis cost or burden. And the factors you see there below are just some of the things that you look at. The type of a workplace, for example, how close are people working together would be one of the things you would want to consider. What sort of duties do they have? Are they taking care of sick patients? The cost in relation to the size of the business. This is real best described as saying this: it's easier for a larger company or corporation to accommodate employees than it is for a smaller business to accommodate employees. And then last, the number of employees that need a particular type of accommodation, you can take that into account. Now, one thing I don't have on the slide here that I would encourage everybody to remember, though, is there have been, in the last administration, some executive orders and directions to the EEOC and others to give full credit to religious concerns of employees in particular. And so that could always come up to be an issue. So I think you really should consider that closely when it comes in. One of the interesting things that's unique about the Montana Human Rights Act is it also protects against creed. And this would be something that I would anticipate would arise in particular in vaccination areas. The only one case I know of in relation to creed and vaccines in Montana actually involved Riverstone Health, where an employee refused to take a mandatory vaccine and an influenza vaccine on the basis of an alleged creed. A hearing was conducted and Riverstone Health prevailed from, among other reasons, because political, social, and philosophical beliefs did not rise to the level of a creed, which is really more like an article of faith or religious belief. I will also tell you on the start that I would believe that Riverstone Health is quite unique in that regard because as a public health entity, they have an obligation for all of their employees to be able to be on the front lines during a pandemic. And that was also quite persuasive to the hearings examiner. Most of us and most employers will not have a similar fact pattern to help in regards to denying a lot of exemptions. Next would be OSHA, which everybody's aware of. OSHA does not have any current standards, and there's no requirement to vaccinate employees, period, for anything, influenza vaccine or anything like that. Generally, they follow the CDC and OC guidance on this. Some general guidelines that OSHA has done, though, because they have engaged in enforcement actions during the COVID pandemic. And the things that they've looked at have been what is referred to as the general duty clause, which is a duty to provide a safe place to work, which, brief explanation, is to be distinguished between a standard in particular. And there are standards that they also applied as well. Respirators. There is a requirement for respirators, for some employees to have respirators, to have training, to have fit tests. There were numerous citations and violations that went out during COVID pandemic related specifically to respirators and to PPE. So if your business is in one of those areas, especially where respirators would be appropriate, you should keep that in mind, and PPE. The Wrongful Discharge from Employment Act, a claim would be possible if you terminate an employee, quite frankly, for refusing to take a mandatory vaccination. And again, when we're talking specifically about the COVID, there's a real issue in this one because of the unique nature of the COVID vaccine at this point. But if there was one brought, you would have to establish that you had a legitimate business reason. I've got the definition under the law as to a legitimate business reason. It's basically not whimsical and are fanciful and related to the legitimate needs of the business. So it's pretty broad. But still, I think under these circumstances, you would have to offer some pretty strong justifications before imposing mandatory vaccination for COVID. Constructive discharge is a claim that could come up where an employee says, basically, no reasonable person would stay here. And I could certainly see that arising if this was, if you were to implement mandatory COVID vaccinations at this point in time, given the nature of the vaccine. So I would again be very cautious about the mandatory vaccines. A couple of things interesting coming up in the legislature that are moving through quickly. Senate Bill 65 revises civil liability laws regarding COVID-19 exposure in particular. It basically removes the issue of just pure negligence and raises the standard. You have to prove, a plaintiff would have to prove gross negligence, willful and wanton misconduct, or an intentional tort. And all of those are extremely high standards normally in the law. Additionally, although it's not in the statute and referenced, in every case, somebody would need to prove that they were exposed to COVID at your location and became ill from that location. So there would be a lot of causation issues. This particular statute is going like a rocket right now through the legislature. I believe it's already passed the House and has probably moved on to the Senate. And as you know, Governor Gianforte has indicated that the passage of this statute in particular is going to be the impetus for him at least to, I believe, strongly recommend removing the mask mandate that we have right now. A new one that has hit right now, which basically would vitiate everything I said before, but I had to say something before I got to this one. It's Senate Bill 132. And if an employer, and this is not restricted to, by the way, to COVID-19 vaccines or anything, if you permit a medical or religious exemption, which I'm going to tell you on almost every case, you're going to have to at least consider and permit those, and you have an accommodation that can be provided for those employees. This is the direct quote from the statutory language proposed. Employers shall make the same alternative accommodations available to any employee at the employee's request. And so basically, as I read that, unless it's amended, you're going to have at least a medical exemption if you follow what I've suggested for any vaccine. And so any employee is just going to have to come in and ask for an exemption, which will completely eviscerate any mandatory vaccinations. So that's pretty much it. It's actually pretty short and sweet, considering how much it's on the radar of everybody right now. But again, this is a unique situation with a unique vaccine addressing a unique disease. And our legislature is moving at record speed right now to address what it considers possible implications of mandatory vaccines. That's it for me.
Thank you, Bruce.
You bet.
John, I think we're ready for some questions. I see quite a few. I do want to just put a few resources in the chat box, some links to the state's website. There's a new site out that shows vaccinations now, and also a site that shows the phase 1 and phase 2 eligibility. So people had asked those in the chat box. One of the first questions is about if you're having another vaccination, such as the shingles vaccinations, should you have your COVID-19 vaccination right away?
So my recommendation on that would be that you probably should have at least 2 weeks gap between the point that you had one vaccination and you would come back with another one. The Shingrix vaccine in particular probably is much more likely to cause fever, chills, muscle aches than even the COVID is. So.
Thank you, Dr. Bush. One of this question is, I've heard that the CDC expects an uptick in cases and deaths in the next month. Also the various variants, many questions about that. And also a question about, should we still be wearing masks, even though there's a possibility that the governor would lift that mask mandate. So variants, Dr. Elner, would you like to talk about that?
Yeah, sure. You know, despite the fact that many people have been vaccinated, I think we're about 13,000 have at least had one shot. We should still continue to be masking. Our recommendation from a healthcare provider is continue to wear a mask as you have been over the last nine months roughly. And it would be a good idea for your patrons also to wear masks when they enter your place of business. Until we've had greater immunity across our community, I guess known as herd immunity, it's still our recommendation to continue the masking and minimize large gatherings.
And could I build on that for just a second, Melanie?
Yes,
I would
absolutely.
say if you want to know how effective the masks are, just look at some of our pediatric practices and what's going on with pediatric care across the country. I've seen some studies that have shown as much as a 40% decrease in pediatric respiratory illness presenting to providers to be treated. And that's most likely all because of the distancing, masking that we're doing.
And just to piggyback a little bit, because obviously I'm strongly in favor of continuing masking. Thus far in Montana, there has not been a single confirmed case of influenza. Influenza spread the same way that COVID-19 is spread, but there's, the state is still reporting no cases. So it really is making a huge difference.
Very good. Could we answer the question on variants? How do you detect a variant? These variants that are coming from the other countries, how are you guys detecting those?
So I don't think either of our hospitals are likely to be doing that test. That would be something, as I said earlier, would be relying on the state potentially using an outside lab. But from a clinical standpoint, it really doesn't matter. We would still be treating the illness the same, would be treating based on the symptoms and what supportive care and those kind of things they would need. So the presence or absence of one of the variants you hear about is not significant clinically.
Thank you. A question for you, Bruce. If an employee claims they are COVID positive, can the employer ask for proof of a positive test? And if so, what can an employer do if the employee refuses that test?
You mean in regards to claiming that they have, that they're going to be off from work?
I believe that's how it's worded.
Yeah, you're entitled to know that they have in fact been instructed to quarantine.
Okay.
So
Excellent.
Melanie, if I can again
Sure.
piggyback a little bit,
Yeah.
when a person tests positive, that positive test has to be reported to the local public health agency, which is us. Then that case is contacted and a case investigation is done. That person gets a document, it's usually by email, that tells them how long they must be in isolation. So that actually has dates on it, the earliest date that person can come out of isolation. So that is in the hand of every person who is a known positive.
So that would be something the employers could ask for. Yes.
Yes.
Okay, so we have lots of questions. I've kind of saved the best for last year. Lots of questions about scheduling to get the vaccine. Are we going to improve the way that people are doing scheduling with the phone lines? Dr. Bush made some references to how to be in contact with St. Vincent. I know that there's similar with Billings Clinic and Riverstone. Could we just talk about this in general, about scheduling, how we're doing it right now, and what the next couple of weeks look like? And I'll start with John Felton.
Yeah, so right now, it appears as though our vaccine our vaccine volume is not going to increase for a little while. The Biden administration has come out and said that they intend to get more vaccine out to states quickly. We've heard 16%, which big round numbers would get another about 300 doses a week into Yellowstone County if we get our 16% increase. When you go back to those numbers of 50,000 people that want to get vaccine, if we're getting 2,000 or 2,300, it's not going to go much quicker. I do believe, and I think there's a general sense of confidence that we will see more vaccine coming into the state and into communities. It's not being held back. It's, as soon as it hits the state, it gets to us. So we will, it will get better. And as I said, at some point, we will likely have, if we get large volumes of vaccine, bigger clinic opportunities. It's just that right now, that there's so few doses and so much demand. And we understand the frustration that people are feeling. And just imagine, the odds, there's 50,000 people that are eligible and they've got a 1 in 25 shot of getting in on any given week. So it's very frustrating to people, and it's frustrating to us. We would much rather be putting a lot of vaccine in arms than answering the calls saying, why can't I get an appointment?
Dr. Elner, would you like to join that conversation?
Yeah, sure. And first, I apologize for those who have tried to get in to schedule their appointment. The call volume has been, like this pandemic, unprecedented. 50,000 calls a day to try to get a vaccine appointment when you only have 975 doses to give per week. And so what we're doing is going to a third party who will be staffed with up to 40 people just there dedicated to take calls for vaccine appointments. But the limiting factor is we can't schedule you unless we know what our dose count is going to be for that week. And so unfortunately, we're at the mercy of the supply that comes in. And, we're going to be looking at the potential of a wait list. So you get in, call, we put you on the wait list. But really, the limiting factor is how many we'll get. And we literally find out just maybe 24 hours beforehand and have to be prepared to give the vaccine as quickly as possible because of the demand. So sorry, I'm answering the question in a roundabout way, but we're doing our absolute best to accommodate the interest, and the interest is good. So it's very appropriate that there's a lot of people who want to get the vaccine.
Great. Dr. Bush, anything to add?
Yes, I would certainly support everything that both Dr. Elner and John Felton have said. I would just add that it actually was really exciting to be part of our first couple of clinics. It was an electric atmosphere in there. People were so joyous to actually have vaccine and be able to go through it. And it was all healthcare workers at that time. I think it was actually before we started, but Bruce Fain had mentioned that this is the novel coronavirus. And so everything is new about it. And so the process that we've put together now may not be the process that we have in 3 weeks, but we are starting this website. It is active now, and it does ask the questions that allows us to tier patients into tier 1B, tier 1C, tier 2. And then we'll keep a queue, and then we randomize the people in that tier as we get appointments available. And as Dr. Elner said, we're very limited on the amount of vaccine we have for those first time doses. But then we can actually call people, get them scheduled when we know that we have the dose for them. So.
Thank you. This is a question for Bruce. What kind of consequences would an employer face if an employee files a claim? And what would be the outcome? Does the emergency use authorization have a stake in whether an employee can require them?
I think the emergency use authorization does have a stake in this case, because you do have to have, my understanding of the CDC guidelines is you are in fact going to have informed consent, which means you have to tell them the risks and explain the risks to it, and then they have to agree to it. It's like when you go into a surgery. I'll defer to the providers to explain that part more than me, obviously, but you have to explain the risks, and then you have to have a signature on it, or else they're not going to operate on you. They're not going to provide you the vaccine. So I think it does have an impact. The claims would depend. I mean, it would be a standard discrimination claim, right, under Title VII, which can result in, compensatory damages if you terminate somebody. It can result in emotional distress damages. Same thing under the Montana Human Rights Act. The WDEA, if you fire somebody because they refuse to get a vaccine, they could make a claim under the WDEA for their wages and fringe benefits for up to 4 years. It's these things why I'll explain first. I'm a very big proponent of vaccines. I'm a very big proponent of mask wearing. Our office had experienced, we had some positive cases And one of the things is that we found out about them because the contact tracers contacted the people who had been in contact, which of course were other employees. And we have been very diligent. We're open now. Most of the lawyers work remotely. Everybody wears a mask outside of their work area. I've always believed in vaccines, but this one is a very unique situation right now. I mean, with the emergency use authorization versus the influenza vaccine. And again, even in regards to influenza vaccines, which are the most commonly fought over mandated vaccine, I would say, there is a large amount of litigation as to whether or not somebody can be forced to have one. And you need to be the appropriate employer, shall we say, to be willing to fight that battle.
Yeah. The next question is similar. It's do employers need to offer paid sick time if employees can't work the day of or after their COVID vaccine?
I'd have to look, and maybe I can, if we can find out where that is, I could put it in. I would think not, though, because I don't think that would fall under any of the guidelines that have been issued under any of the COVID relief for unemployment or things like that. I would say this, and this would show you, again, my propensities and my beliefs in this. That would sure be one way to encourage employees to get the vaccine, right?
That's a great
Because
point.
if they become ill and then you dock them pay because they don't show up for work, that doesn't seem to be a very good advocacy position for getting people to comply with your desired goal of having them vaccinated.
Yeah. I have another great question for our medical partners. If you've had COVID-19, should you get vaccinated? And if yes, how long after?
Should you get vaccinated?
So we do recommend that. And I've seen common recommendations of 2 to 3 months after you've finished your isolation period with the illness. But the CDC would allow you to have the vaccine the week after. So it's not firm.
Unless you had, the one place CDC does draw a line is if in the course of treatment you received either the convalescent plasma or the monoclonal antibody, then they do require a 90-day.
Correct. Yeah.
It does say if you've had and recovered from COVID without those, you can jump right in line and get a vaccine.
Good to know. John, did you have some emails that you said had come in, or did
Yes,
we get most of them answered?
We've got most of them answered. There is one regarding distribution in satellite locations when the time is right and the demand is there and we have the supply available whenever that may be. We've had some members ask us, say that they would be interested in being eligible vaccine providers if they've got a large employment base and they have medical professionals on staff, proper storage, and so on. And then a similar question came in regarding satellite distribution through pharmacies and so on.
John Felton,
Yeah,
you want to
so
take that?
the window, at least the initial window for being a vaccine recipient has closed. So right now someone can't go into the DPHHS and say, we'd like to become a vaccine distribution site. That doesn't mean to say that won't reopen at some point. And as I mentioned earlier, what's on that is all kinds of things like pharmacies and individual medical practices and sites of care and things like that. So I do believe that when we get enough vaccine, we're going to start to see the vaccine flow out to those places. And then it's going to be much easier. There was a question in there that I'm going to jump to real quickly, and that was how many people in the county have received at least one dose of vaccine. So Melanie put in the chat box the site, you can go look at that. But in big round numbers, about 14,000 people have received at least one dose of vaccine, and 3,200 are fully vaccinated, meaning they've had both vaccines. So we've got about another 10,000 or whatever it is that are, or I guess about 7,500 have received one, and then the others have received two. So When Dr. Elner mentioned herd immunity or population protection, whatever term you like better, you really need to be talking up in the range of 70% of the population. That's not an absolute number. It's not like a light switch that you hit that and it changes, but 70% of the population of Yellowstone County, big round numbers, is a little north of 100,000. And we have right now about 3,000 that would be considered fully vaccinated. We have another 15,000 that have been ill and at least been exposed that we know of. So we have a ways to go. That's why I keep telling folks that there is a light at the end of the tunnel, but we're not quite to the end of the tunnel yet. So we really need to be careful with our masking and distancing and hygiene and sanitation and staying home when you're sick. All those things do need to stay in place for quite a while longer.
Awesome. Thank you. Well, it looks like we have answered all of our questions. I'll give one more minute if anybody has a last minute one, but I would like to just say thank you to Dr. Elner, Dr. Bush, John Felton, Bruce, and to John and the Chamber for hosting this today. The one piece of information I'd like to share with you is every Monday, there's a group of communication people that put out a press release about the updates of the vaccine that is available and how to make appointments. So our local media is sharing that for us. And so you can always go to the Riverstone site and see that, but that does happen every Monday, probably by around noon. So just a place to go if you're looking to make an appointment. So John, I'll let you wrap this up. Thank you.
Wonderful. Thank you, Melanie, and thank you for supporting this program as well, and to Stockman Bank as our title sponsor. I think we are ready to wrap up, but as we do so, thank you to all our presenters. A special thank you to all of the healthcare workers, Dr. Bush, Dr. Elner, John Felton. If you will pass along to your entire staff that we so appreciate their dedication, their hard work, the time that they've put in, their lives that they've put on hold from a grateful community. We just want to thank them. And thank you all for the time today. And Melanie has posted resources for people that have questions that come up after this call. And you can see from the chat box and from the Q&A spot, Dr. Elner, Dr. Bush, John Felton, and others are just always so accessible and helpful in getting to the bottom of your answers. So on behalf of the Billings Chamber and Big Sky Economic Development, thank you all for joining us.
Thank you.
Thank you, John.
All right, thank you. I was trying to get an answer in there real quick. So,
Oh, yeah, well, I'll keep it open while you're doing
okay,
that.
I got it sent. It's fine.
Okay.
Thanks. Bye-bye.
Thanks, Melanie. Looks
You
like we
bet.
got,
Thank you, John.
yeah, I think we got to all the questions like you said. And
Yeah, I think so. Dr. Elner was answering them sometimes faster than I could get to them.
providing his phone number and other ways to get to the bottom of any concerns people might have. So
but I think that makes people feel great. So
very much.
all right. Well, thanks. I'll see you at 3:30, I think.
Yes, thank you.
Bye.
Bye.